Hello, everyone. Scott Schwartz, Never Too Much Money. So, yesterday we took a look at Medicare supplements. Today we're going to look at Medicare Advantage. You cannot have both. It's a choice of one or the other. And with Medicare Advantage, this is where the annual enrollment period comes in. The window is open now. It opened October 15th and it stays open until December 7th. So if this is an attractive option to you, as it is to many people, you'll want to make a decision within the next month and a half is about all you have before that annual enrollment period ends. So let me show you what is available. Now this, you can see there is a Humana plan, Humana Gold Plus, one of three companies that I represent. They're all very similar, so I just chose this one at random. For the zip code that I chose, my resident zip code, it's a $0 premium. You will still pay your Plan B premium, $148.50. But there is nothing in addition to that. A nice benefit of Medicare Advantage is you have an out-of-pocket maximum. You notice that is an in-network maximum. So as long as you stay within your network, then the expenditures are capped for you. We're going to look today at outpatient care and services. Quite a variety, and understand this is not comprehensive. This is a summary. So you see acupuncture, a copayment for acupuncture with a maximum of 20 visits per year. Additional services, one of the more common one that I have people ask me about is a fitness benefit. The way most Medicare Advantages work is any gym that participates, and just about everyone that has a Silver Sneakers program does participate, then you get a $0 membership. They're trying to encourage good fitness because it will help them to bring their costs down, of course. A meal benefit, that is sometimes misunderstood. The meal benefit, generally speaking, is after you've had a covered hospitalization, then as you return home, then you can have a meal delivered to you for a limited period of time. You notice it says prior authorization required. So it's not just, an open, hey, all my meals are provided now. There are stipulations and requirements to that. You can see you have a benefit for both ground and air ambulance. Chiropractic services, another common one that I'm asked about many times. You see a $20 copay there with a prior authorization required. So if you want to be sure that your chiropractor is covered, remember this is in network and Medicare covered. So you'll want to check with me to make sure that your chiropractor is in network. Same is true of your dentist. The way the dental services work, preventive, you notice all $0 copays, which is great. But don't miss this part here. Maximum plan benefit of $1,000 every year for preventive. So let's say, for example, you're cleaning, maximum 6 visits per year. I don't know of anyone that uses that many visits for cleaning a year. But let's say your dentist charges $250 each time. And so you would have 4 visits then to reach that maximum of $1,000. So even though here it says you would get up to 6 visits at $0 copayment, in that scenario, because of how much your dentist charges, you'd really only get 4 such visits before that maximum plan benefit is reached. Now that is all on the preventive dental side. Down here, the comprehensive, you're getting into the other things now. Non-routine, restorative, periodontics. You see you do have a copay there and maximum number of visits per year with a $1,000 maximum plan benefit. Diabetes, both supplies and services. So say, for example, you've got diabetic therapeutic shoes or inserts covered. So Medicare Advantage will cover even more than just doctor visits and medication, things such as that, such as those special shoes, as they are pre-authorized, are covered. Diagnostic tests, lab, radiology, x-rays, you see there. Now, where you see a range, and I wanted to highlight this here, you see a rather large range, $30 to $295. That is something you want to check in advance. How much is this going to cost me? Either the company will tell you how much they will cover, or the provider will let you know what they charge, what it'll come out to. Again, prior authorization required for all of this. And as a part of that prior authorization process, you'll know where you are in that range. Doctor office visits for your primary care physician, $0. For a specialist, $30. That's important to know the difference there. Durable medical equipment, which would be things such as wheelchair, cane, that kind of thing, you have a 20% coinsurance with prior authorization needed. Emergency care, notice that copayment is waived if you're admitted within 24 hours. So that's a nice benefit to have. Hearing services, you've got a copayment for the exams. A routine hearing exam, $0 with one visit per year. And you see a range here for hearing aids. This particular plan, the cost is from $699 to $999. My oldest brother, he got free hearing aids through his Medicare Advantage policy. You see home health care covered, $0 copay. Outpatient mental health care. Prescription drugs will be another topic for another live stream. Rehabilitation services is broken into categories. Here you see cardiac and pulmonary, $0 copay, but for occupational therapy, that's not the case. That's $30. Physical therapy, speech language, $30. Something else with prior authorization needed, where they will clarify just how that's classified. Outpatient services and surgery, you see what the coverages are there. And I know I'm going through this quickly, but as you're shopping and making decisions, of course, I'll sit with you and make sure you understand all the options in detail. I just want to give you an overview of what's covered so that you have an idea of just what is Medicare Advantage. You see outpatient substance abuse is covered. Over-the-counter health items with a $0 copay, but they're not necessarily covered in themselves. You do on this plan have a $75 allowance every 3 months that you can use for vitamins, herbal supplements, whatever the case may be. Podiatry services, preventive services, all $0 copay. They want you to get those preventive services done so that any problems are caught early and can be managed successfully. So a long list of different screenings. What I wanted to highlight in particular, your COVID shots, flu shots, all covered, $0 copay. Prosthetics, dialysis, urgent care covered much more inexpensively than emergency services. So you want to be discerning as to how you decide to use those. And then the last one I'll look at briefly, vision services. You see the copays there with a $0 on the routine eye exam every year. And then for eyewear, maximum plan benefit of $100 every year. So that gives you an idea of what Medicare Advantage covers. I'll work with you one-on-one on the specifics. Tomorrow, we'll look at prescription drugs and how those are covered. That can be very confusing, but we'll take time to take a look at that. Thank you, everyone. Scott Schwartz, nevertoomuchmoney.com.